Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with fertility and pregnancy, E and F. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions, then I'll move on to ailments of the brain and nervous system, then I'll address issues of skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, issues of the hormones and the metabolism, homeopathic remedies on infections, infestations in the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, problems of infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories, called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Natrum-Muir people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, Lycopodium types tend to be tall, ganglion, of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with fertility and pregnancy, E and F. Every month during a woman's reproductive years, a ripe egg is released from her ovary and enters the fallopian tube, and the mucus of the entrance of the womb at this time becomes less sticky. If intercourse takes place, millions of vigorously swimming sperm make their way through the mucus into the womb and into the fallopian tubes, where they congregate around the egg, causing it to spin around with the movement of their beating tails. Eventually, one sperm penetrates the egg, and the nuclei of sperm and egg fuse, and the process of cell division begins. The fused nuclei split into 2 cells, then 4, then 8, then 16, all containing the 46 chromosomes that will create a new and totally unique human being. 7 days after fertilization, this ball of cells embeds itself in the wall of the uterus. At 20 days, the placenta begins to form. At 30 days, the spinal cord. At 6 weeks, the heart. And by 13 weeks, all the body organs are formed. At 5 months, the baby can be felt to move. At 6 months, the lungs become functional and the nostrils open. At 7 months, the baby should be in the head-down position ready for birth. A full-term pregnancy usually lasts 38 weeks, counted from the moment of conception to the time the baby is born. Conception usually takes place halfway between periods if the woman's cycle is 28 days and regular. However, since many women's periods are not exactly 28 days, pregnancy is usually measured as being 40 weeks from the first day of the last period. Common pointers to pregnancy are missing a period, more than usual tenderness or swollen breasts and darker nipples, nausea, tiredness, a frequent urge to pass urine, and sometimes loss of appetite or cravings for unusual foods. To confirm the pregnancy, the woman should have a pregnancy test. The chances of having twins are about 1 in 80. Identical twins develop from the same egg and share the same placenta. Non-identical twins develop from different eggs and have a placenta each. Only 3 pairs of twins in every 10 are identical. Triplets are much rarer, only occurring in 1 in every 6,400 pregnancies. Once it is determined that the woman is pregnant, it's important for her to go for regular prenatal checkups. Prenatal care is important since it allows you to find out at an early stage if there are any problems. An ultrasound, which is a sound picture of the baby in the womb, is thought to be harmless to mother and baby and can be used to monitor the size, shape, and position of the baby at any stage of pregnancy. Amniocentesis, which is the taking of a sample of the amniotic fluid around the baby, is usually carried out between 16 and 18 weeks, but only if a previous baby has been abnormal or if there's a family history of congenital problems or if the mother is over 35. Here in brief are some of the do's and don'ts of pregnancy. Treat your baby as a person from the word go. Moderate exercise such as swimming and walking in the fresh air are very good, but anything that involves repeated compression of the spine, such as horse riding or trampolining, should be avoided. Always keep 25% of your energy in reserve. Do go to prenatal classes. They will teach you what to expect and how to breathe in order to cope with pain during labor. Don't wear tight clothes and get as much sleep as you can and avoid late nights. Also, don't sit in hot baths for too long. 10 minutes is about the maximum, especially if you faint easily or have a tendency to bleed. Avoid serious traveling if you can, especially if you have had a threatened miscarriage or there are complications or you suffer from travel sickness. Most airlines do not like you to fly after 32 weeks or so, so if you must fly, check with the airline first and stop working before 28 weeks if your work is very strenuous. The expectant mother needs to eat a healthy and well-balanced diet with an increase in iron and calcium foods, and also a modest increase in protein intake, preferably in the form of oily fish, nuts, seeds, pulses, and whole grains, with generous helpings of raw vegetables and fruit, will help to guard against constipation. Tea, coffee, and alcohol should be avoided, as well as chamomile tea, especially in the latter stages of pregnancy. Homeopathic remedies during pregnancy. During the first 3 months of pregnancy, the most vulnerable time, you should avoid all medication if you possibly can. That means prescription drugs, recreational drugs, over-the-counter preparations from drugstores and health food shops. There is no evidence that homeopathic remedies cause any problems during pregnancy, but to be on the safe side, since they should not be taken in potencies less than 6C, except for tissue salts, it is possibly best to avoid low-potency Apis altogether and take 30C if you need to. For minor complaints during pregnancy, homeopathic remedies should be tried first. If you feel very unwell, see your doctor before taking anything. Diabetes during pregnancy. Diabetes can declare itself during pregnancy, especially if previous babies have weighed 9 pounds or more at birth. If urine tests during regular prenatal checkups reveal high levels of glucose, you will be given a glucose tolerance test. If it is positive, your doctor will prescribe dietary or insulin treatment as necessary. Constitutional homeopathic treatment is also recommended. Pre-existing or not, diabetes during pregnancy requires careful management since risks to the mother and baby are twice as high as normal. Risks of neonatal death is also much higher. If diabetes is severe, you may need to spend the last 10 weeks of pregnancy in the hospital, induce a C-section, and may be recommended to have the baby at 36 weeks. Self-help. Control of diabetes takes considerable self-discipline, especially where the diet is concerned. Your doctor will give you a detailed diet sheet. Diarrhea during pregnancy. The danger of diarrhea during pregnancy is that it may trigger a miscarriage. If 3 or more successive bowel movements are very loose and watery, see a doctor within 2 hours. In the meantime, select a remedy from the list that follows. Specific remedies to be taken every hour for up to 10 doses. Cramping pains in the abdomen, yellow-green stools that look like chopped eggs. Use Chamomilla 6C. Cramping pains in the abdomen, stools yellow-green and watery, slimy tongue and bitter taste in the mouth, no thirst, symptoms are worse at night. Use Pulsatilla 6C. Diarrhea follows overchilling after exertion. Use Dulcamara 6C. Diarrhea makes you rush to the lavatory first thing in the morning, no abdominal pain. Use Sulphur 6C. Ectopic pregnancy is the development of the fetus in one of the fallopian tubes or in the abdominal cavity rather than in the uterus. The symptoms are persistent abdominal pain and bleeding as the placenta burrows into surrounding tissues to establish the fetal blood supply. The cause may be some abnormality of the fallopian tubes due to a previous operation or infection, or the presence of an IUD. If there is bleeding and abdominal pain lasting for more than 3 hours, see a doctor within 2 hours. You will be sent to the hospital and may need an operation to remove the developing pregnancy, and possibly the fallopian tube as well. If the other tube is in good shape, you stand a good chance of becoming pregnant again, and in the normal way. Specific remedies to be taken every half hour for up to 10 doses if an ectopic pregnancy is suspected. Feeling very worried and afraid, use Aconite 30C. Abdominal pain accompanied by bleeding, use Arnica 30C. Emotional disturbance during pregnancy. Pregnancy is an emotional time for many women. Moods fluctuate very rapidly. Joy, fear, anger, and so on seem to be more intense than usual. Hormone changes are partly responsible, but cognitive processes are also involved. Very strong emotions in the mother affect the baby, so if you find your emotions distressing, take one of the remedies that follows. Specific remedies to be taken every 12 hours for up to 3 days. Fear, apprehension, fear of dying, pale face, palpitations, fainting fits. Use Aconite 30C. Fear, apprehension, feeling of anguish, trembling, breathlessness, face dark and flushed. Use Opium 30C. Fear, apprehension, diarrhea, feeling chilly all the time. Use Veratrum 30C. Fear, apprehension, face red and hot. Use Belladonna 30C. Grief, feeling sad, constricted feeling in the chest, limp in throat, headache. Use Ignatia 30C. Grief, indifference to people and surroundings, lack of energy. Use Phosphoric acid 30C. Anger, breathlessness, fidgeting, diarrhea, bilious attacks. Use Chamomilla 30C. Anger, irritability, being overcritical. Use Nux 30C. Anger, wanting to be left alone, worrying about money. Use Bryonia 30C. Joy, inability to sleep, going over the top. Use Coffea 30C. Excessive salivation during pregnancy. Profuse salivation during the first trimester of pregnancy is distressing because one wants to spit all the time. Most sufferers cope by carrying a large box of tissues around with them. The remedies that follow are also recommended. Specific remedies to be taken 4 times daily for up to 7 days. Profuse salivation, dribbling on the pillow at night, sweet metallic taste in mouth. Use Mercurius 6C. Excessive salivation accompanied by nausea, aversion to food, tongue looks white or yellow. Use Pulsatilla 6C. Symptoms as for Pulsatilla, but the tongue is clean. Use Ipecac 6C. Too much saliva, feeling weak, chilly, restless, and worried. Use Arsenicum 6C. Too much saliva, forehead cold and sweaty, feeling weak and apathetic. Use Veratrum 6C. I have a great many videos now on many different topics, so I've decided to make several different video playlists so that it's easy to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.